So looking at some muscular adaptations to anaerobic exercise, and again, a lot of it's going to depend upon the type of anaerobic exercise that you're doing, because there's obviously different modes of exercise and that would get classified as anaerobic. So we're going to look at the structural and architectural changes. So resistance training increases myofibrillar volume, cytoplasmic density, sarcoplasmic reticulum, T-tubular density, and sodium potassium ATPase activity. So what this does, these different items help to enhance muscle hypertrophy or an increase in size of the muscle. Sprint training in particular will enhance calcium release. So obviously sprint training, short duration, will be utilizing the anaerobic energy systems, and that'll enhance calcium release. And then resistance training increases the angle of pennation. So you're looking at the architectural changes. So if you remember going back to the first chapter when we talked about the structure of the musculoskeletal system, we kind of talked about fiber orientation, and the resistance training will actually increase that angle of pennation. Other muscular adaptations that are going to occur, there's actually a reduced mitochondrial density. So the mitochondria is the kind of the powerhouse of the cell that works particularly during more aerobic activities or activities where your body is able to utilize oxygen for energy. Now, there's a little bit of a caveat to that. So even though there's reduced mitochondrial density, that's relative to the increase in size of the muscle. So the muscle increases in size, therefore the density of the mitochondria, the number of mitochondria, can actually remain constant or actually possibly increase as a result of anaerobic exercise. So it's more due to the increase in size of the muscle as opposed to just having the mitochondria get smaller or reducing the number of them. There's also decreased capillary density. Again, you're going to be thinking about an increase in size of the muscle, so that's just going to reduce the density of that. There's increased buffering capacity, so increased ability to maintain an acid-base balance. And there's also changes in the muscle substrate content and enzyme activity. So particularly ATP and creatine phosphate, which are two substrates responsible for anaerobic energy production. So those are other muscular adaptations that you would be able to see within the muscle through anaerobic exercise. And again, there's obviously ways that can be manipulated in different fashions through, sets, reps, the type of exercises you're doing, which, we'll get into at a later time. So here we look at the connective tissue adaptations and bone remodeling. So our bones are always remodeling. So if you look at this picture, they're kind of illustrating some different things. So, osteoblasts are the bone cells that build up bone, okay? They're not pictured in here, but osteoclasts are the cells that break down bone. So bone is constantly breaking down, building up based upon forces applied to it. So when we look at this, the application of longitudinal weight bearing, which is what's being kind of highlighted in this picture right here, they're showing force application. Okay, so when you're getting longitudinal weight-bearing forces, it's actually going to cause the bone to bend a little bit. So, and that's what you're seeing with the dotted line. That's going to create a stimulus for new bone formation. So weight-bearing strength movements are actually really good for building up bone, increasing bone density. And what you see is then the osteoblasts start to lay down additional collagen fibers. And you'll also get previously dormant osteoblasts or osteoblasts that weren't doing anything will also come in. And what that'll essentially do is eventually over time, the collagen fibers will kind of eventually mineralize and become new bone. Okay, so this is why, again, one of the best things you could do as far as bone density is weight-bearing exercise, particularly strength training, because the forces that occur with the strength training movements will actually increase your bone density. Now, obviously, again, too much, if you're applying too much force, you're not recovering, that could cause issues. Most of you have probably heard of what a stress fracture is. Stress fractures are when, the bone can't remodel because there's too many forces being applied. So there's definitely a balance between applying force to the bone, letting it remodel during recovery, and letting it get better, as opposed to continually applying force to it. So general bone physiology. So again, trabecular bone, which is the spongy bone. So there's two different types of bone. You have trabecular bone, which is the spongy bone on the inside of the bone, and you have cortical bone, which is the hard bone on the outside. Okay. Trabecular bone responds more rapidly to stimuli than cortical bone. Okay, that's because it's the softer kind of spongy bone on the inside. Minimal essential strain is the threshold stimulus that initiates new bone. So you basically need forces that either reach or exceed a threshold stimulus in order to initiate new bone formation. So you do have to provide, it's just like anything else. It's no different than what goes on with the muscle. You have to provide a degree of overload. And the minimal essential strain is approximately 1/10 of the force required to fracture bone. Okay, so it doesn't have to be an extreme amount of force, and obviously you don't want it to be, because again, eventually the force could have cause damage. And at the same time, you want to make sure, again, recovery is going to be an important factor with that. So it's important to make sure that individuals will not only apply force, but then they'll also recover as well. So anaerobic training and bone growth. So again, muscle strength and hypertrophy gains increase the force exerted on bones. So as your muscles are getting bigger and stronger, they're obviously going to put greater forces on the bones as well. When your muscles contract, again, they attach to bones, so there's going to be also forces there as well. And that's going to correspond as well with an increase in bone mineral density. So in addition to the longitudinal forces and weight bearing playing a role, the muscle forces will also do this as well. The components of mechanical load that stimulate bone growth. Okay, so there's 4 primary components that are going to be factors that cause bone growth to occur. That's the magnitude of the load, so how heavy the actual load is, the rate or speed of loading, the direction of forces, and the volume of the loading. Okay? So magnitude, rate, direction, volume, okay? A volume of loading are going to be all things. Basically, volume of loading looks at the number of repetitions. So it's important to note that bone tends to respond better to higher loads. So somewhere between a 1 and 10 repetition maximum is really kind of the optimal range. So anywhere in between there, obviously there's different changes that'll occur doing a heavy single 1 rep max versus a 10 rep max, but that range kind of represents the load, if you will, that will kind of stimulate bone growth. So we kind of summarize up. So how can athletes stimulate bone formation? And again, this is an important part of exercise, just whether it be for athletes or for general population. So the first way they can do it, use exercises that directly load particular regions of the skeleton. Okay, so again, you obviously want to, again, there's the concept of specific adaptation to impose demands. When you load a particular region, that particular region is obviously going to get a greater benefit than kind of uninvolved areas. The second way they could do it, use structural exercises to direct force vectors through the spine and hip, okay, and that will also allow for greater absolute load. So think of big multi-joint exercises. So take something like a barbell back squat. That's going to put significant loading on the spine and hip region, and it's also an exercise you'll be able to use more weight for. I mean, think about it. You'll be able to use more weight for a barbell back squat than you would maybe for like a lunge or something like that. So you'll certainly get, a structural exercise that loads the spine and the hips will definitely do that. Overload the musculoskeletal system and progressively increase the loads as tissues become accustomed. That's the third way. So again, once you become accustomed to a load, you just have to, again, continually look to increase it. And the fourth way is just vary exercise selection. So the more exercises you do, different variations and things of that nature will kind of change the distribution of the force vectors and always give you kind of a unique stimulus. The other benefit to that too is you do sort of allow it a certain degree of recovery when you switch exercise. So in other words, if you just look at different squat variations, using different types of barbells, doing a front squat versus a back squat, you slightly load the body differently, and you're not going to basically stress the same areas all the time, but meanwhile you're still doing a heavy structural type of exercise. So those are 4 ways that you can get kind of your ideal connective tissue adaptations when you're working through your training sessions. So again, other types of soft tissue has to adapt as well. So we have to look at the tendons, ligaments, and fascia. So we know kind of again what the muscle does or the active contractile tissue, but these other tissues here, they're also going to adapt to these forces. So again, the primary stimulus for the growth of these soft tissue structures is the insult from mechanical forces created during exercise. So again, muscle's not going to be the only thing that's going to be affected. We obviously talked about bone, but these other types of soft tissues also have to adapt, and it's particularly important for them to adapt because obviously, again, when you're talking injury prevention and things of that nature, it becomes very important. The degree of tissue adaptation, again, just like we talked about with bone and muscle, is proportional to the intensity of the exercise. So it's important that there is high intensity exercise incorporated, particularly for athletes to be able to withstand the demands of their individual sport. Consistent anaerobic exercise that exceeds the threshold of strain stimulates connective tissue changes. So again, we have to make sure that we're exceeding a threshold of strain at the same time allowing for a good amount of recovery, okay? When we're looking at these soft tissue structures, the primary structure that kind of makes it up is collagen. So collagen is the substance that kind of makes up the bulk and provides strength for these different types of soft tissue. And there's collagen present in the muscle as well. But collagen is basically a protein that makes up the majority of these soft tissues. And obviously we're looking at type 1 collagen making up the majority of what you see in tendons, ligaments, and even in bone. Type 1 collagen is present. And the cell that stimulates the production of collagen is what's called a fibroblast. Okay, so a fibroblast is the cell that produces collagen, and again, collagen is going to be that protein, that protein fiber that basically provides some strength to the tissue. So here you see a picture of the collagen fiber and kind of the breakdown. We saw kind of a similar picture when we were breaking down muscle tissue. So here you have them going all the way down to the microfibril, fibril bundle of those is a fiber. Then you have your collagen bundle, okay, made up of various fibers. They're basically teasing out. This is the MCL of the knee, okay. They're basically teasing out that ligament to kind of show you what it's like. You also see up top, they're showing you the procollagen. That's kind of what they call a pavement protein. So it kind of makes up the structural base for the collagen, and the strength from collagen fibers comes from cross-linking. So the cross-linking that you see here is basically what's going to provide that strength for the collagen. Now, the other important component of the soft tissue is what's called elastin. So while collagen gives the tissue kind of its strength, elastin is what provides elasticity to the tissue. So all our tissues have a certain degree of strength, but they also have a certain degree of elasticity where when they get stretched, they can kind of many times go back to their normal resting length as long as they're not stretched to the point where they cause damage. So collagen and elastin are your two, primary things that make up these other forms of soft tissue, collagen providing the strength, elastin providing for elasticity. So again, continuing to look at these connective tissue adaptations, first it's important to note, so you're going to get increased functional capacities in conjunction with strength and hypertrophy of the muscles. So you want to make sure that you're also doing things within your anaerobic exercise, while you'll get some change with the strength of the muscles and the strength and the hypertrophy. You still want to do some things that will particularly work on increasing the thickness and hypertrophy in these other types of soft tissues. So these are sites where load-bearing capacity and increases in strength will occur with these. So at the tendon and ligament bone surface, so we know right where tendons and ligaments attach, there'll be direct increase in load-bearing capacity and strength at that point. You could have an increase in strength within the body of a tendon or ligament and within the network of fascia and within the skeletal muscle. So those are all different areas where you'll start to see some of these different changes take place within doing anaerobic training. And again, this will be important, and there could be some times within training where what you decide to select as far as exercise selection and what have you, that will improve and make these adaptations occur. So there's other things we want to look at. So again, specific tendinous changes that contribute to size and strength increases. So these are things particular to the tendon. It's important to note that tendon metabolism is a little bit slower than the muscles, and that's primarily because there's less blood flow to tendons. So tendons don't have the blood flow to them that muscles do. So what could happen with a tendon is you get an increase in the collagen fiber diameter. So those individual collagen fibers, I know we showed a picture of a ligament. Tendons kind of have a similar makeup as far as a breakdown of the different fibers. Greater number of covalent cross-links within the hypertrophied fibers. So remember, we said that the cross-linking is where the strength is going to occur. An increase in the number of collagen fibrils, and an increase in packing density. So not only do you get an increase in number of the fibrils, but you also get an increase in the packing density. So you get kind of more of those collagen fibrils kind of packed together, which will continue to increase the strength of the tendon. And obviously we want good tendon strength, because if the tendon doesn't kind of keep up with the strength of the muscle, then that's where you could kind of get into some issues with injuries. I mean, you typically don't have tendon tears in young individuals. Typically, younger individuals tend to develop just more, chronic issues with the tendon, tendinopathies, tendinitis, what have you. But certainly, it's still a concern. You want to make sure that you're allowing the tendon to kind of adapt to what's happening with the other tissues in the body. So again, kind of looking at this from the standpoint of tendons, ligaments, and fascia. So now we're just kind of coming back to looking at all the different types of non-contractile soft tissue. Exercises of low to moderate intensity does not markedly change the collagen content. So again, there's going to be kind of that threshold that you need to kind of exert, surpass in order for adaptation to occur. If these other soft tissue, much like the muscle, if they're not exposed to something that doesn't stimulate change, you're not going to have that. High intensity loading results in a net growth of the involved connective tissues, and that forces should be exerted through a full range of motion of a joint. Okay, so you want to make sure you're including full range of motion exercises, because that's going to be what stimulates that connective tissue. So, you see people doing a lot of partial range of motion things, which isn't necessarily wrong to do. And there are exercise variants and times where some partial range of motion becomes valuable. However, they do need to make sure that they're exerting forces through a full range of motion, because otherwise you're not going to get this other soft tissue adaptation in order for, again, appropriate changes to occur, and then, possibly increase risk of injury. Okay, so now we're going to look at another form of connective tissue. We're going to look at the cartilage. So cartilage is kind of unique. We kind of separate cartilage out from the other non-contractile tissue. It should be known cartilage is primarily made up of what's called type 2 collagen. Okay, and there are different types of cartilage throughout the body. For the most part, when we look at the functions of cartilage, cartilage's primary purpose is to provide a smooth joint surface for the articulating surfaces of the bones. It could also act as a shock absorber for the forces directed through joints, and it could also aid in the attachment of connective tissue to the skeleton. So those are all the different functions of cartilage. There are different types of cartilage. There's articular cartilage, which is the cartilage at the end of your long bones, and again, that provides for that smooth articulating surface. It acts as a shock absorber. And then you have what are called fibrocartilage. So fibrocartilage is if you think of the discs in the lumbar spine, or in the entire spine, just in the spine in general, not just in the lumbar spine, the meniscus in the knee, and where tendons attach to bone are what are known as fibrocartilage, okay? So there's slightly different structural things with fibro versus articular cartilage. For now, we're just going to look at just some of the general points of cartilage. So cartilage lacks its own blood supply. So unlike the other soft tissues, it does kind of lack its own blood supply. It basically depends on the diffusion of oxygen nutrients from synovial fluid. So your articular cartilage inside your joints doesn't have a blood supply. So that's why when you damage articular cartilage, it's such a big issue, because it kind of heals in a different way that doesn't permit it, much like some other soft tissues. So that's an important point. And joint mobility is linked with joint health. So the reason why we're saying that is because as long as you can move your joints well, you're going to push that synovial fluid. So synovial fluid is the fluid inside the joint, and that's actually going to be what allows joint health to maintain itself. When you kind of lose range of motion and that synovial fluid doesn't move around and the cartilage doesn't have anything to either get nutrients from or adapt to, then your articular cartilage will start to wear down, and you'll start to develop an osteoarthritis or something of that nature. So movement about a joint is going to create the changes in pressure in the joint capsule and drive nutrients from the synovial fluid into the articular cartilage. So joint mobility, very important. So again, that cartilage doesn't have a blood supply, so we need to make sure that the synovial fluid is moving around and able to provide nutrients to continue to maintain health of the cartilage. So how can athletes stimulate connective tissue adaptations in cartilage? Well, again, much like a lot of other things, weight-bearing forces and complete movement through full range of motion seems to be pretty essential. Okay, so again, similar, nothing really completely different from what we talked about before, just the emphasis on weight-bearing forces. So, for instance, when you look at the knee, the articular cartilage in the knee, it's not uncommon for people to develop osteoarthritis in their knee. The more weight-bearing forces, again, given the fact you have proper recovery and you're not overloading the joints, you're going to get, again, that nutrient infusion from the synovial fluid within the joints. Moderate or aerobic exercise seems adequate for increasing cartilage thickness. So it should be noted that aerobic exercise could certainly be good for that as well. And strenuous exercise itself does not appear to cause degenerative joint disease. So, when people say, well, a certain type of exercise is dangerous because it's going to be rough on your joints. Well, yeah, strenuous exercise can be rough. Again, the key is recovery. So, that'll be something we talk about later on when we're talking about, kind of just some general ideas on how to structure, resistance training. But even like heavy resistance training, it's not going to inherently cause damage. It's only going to cause damage if somebody doesn't recover appropriately, okay? So those are all things we want to look at in being able to stimulate cartilage. So the idea is the more activity you do, again, given you're allowing yourself recovery, you're going to allow, your soft tissue in your body to stay healthy and prevent problems down the road. So looking at the endocrine responses and adaptations to anaerobic training, and we looked at some of this already when we looked at the endocrine system, so this is kind of a nice tie-in to what we've discussed previously. So there's an acute anabolic hormone response when we look at anaerobic training. So, and again, acute kind of just means an immediate onset. So in other words, when you exercise in that kind of immediate time frame, you have this anabolic hormone response. There's going to be an upregulation of anabolic hormone receptors, and that's going to be important for mediating those effects. Okay, so for the acute anabolic hormone response is critical when you're looking at anaerobic exercise for performance and then subsequent training adaptations. So the adaptations that you want to get, okay, so for instance with resistance training, resistance training is typically going to be done in anaerobic fashion, particularly when you're talking about things like muscle hypertrophy and things of that nature. That response is going to be particularly important for that. And again, we're looking at our anabolic hormones, particularly testosterone and growth hormone. So chronic changes in the acute hormonal response. So in other words, that immediate response and how that kind of functions over time. So consistent resistance training can improve the acute hormonal response with anaerobic exercise. So in other words, the responses that will occur acutely in response to a workout from particularly from growth hormone will increase. Okay. Now, as far as resting hormone concentrations, the chronic changes here is less likely. So you don't have resting hormonal changes per se after exercise. So in other words, you get that kind of acute spike in response to a workout, but then, over time you get back to resting levels. And again, this would be counterproductive to have chronic changes in resting hormone concentrations, because then you wouldn't get the responses you get from having the acute spikes from the workouts, if you will. And you get some hormone receptor changes. So resistance training has been shown to upregulate androgen receptor content within 48 to 72 hours after a workout. Okay, so you do get receptor changes, which we said the hormones have to bind to a receptor in order to have changes occur. Two important things for that is the volume, or how much work you're doing. And the other thing they suggest is doing protein and carbohydrate ingestion around the time that you are doing your training. That will continue to assist and help with those hormone receptor changes. So looking at the cardiovascular and respiratory responses to anaerobic exercise. So again, there's going to be, again, how much this occurs is going to be based upon, again, the type of mode of exercise that you decide to do. So acute cardiovascular responses to anaerobic exercise. So an acute bout of anaerobic exercise significantly increases the cardiovascular responses, especially if the individual uses the Valsalva maneuver. Okay, so the Valsalva maneuver is when the person kind of bears down and holds their breath to do something. So if you can picture a person trying to do a heavy deadlift for 1 rep. They kind of take in a deep breath, hold, they bear down, and they kind of hold their breath, or maybe just release it a little bit when they're when they're kind of getting through the range of motion in the lift. That's the Valsalva maneuver. Particularly, there's increases in various measures. So you could have an increase in cardiac output, which we've talked about before, an increase in stroke volume, increased heart rate, oxygen uptake, increased systolic blood pressure. So the systolic blood pressure is the pressure in the blood vessels when the heart's contracting, and increased blood flow to active muscles. So all of these increases will occur as a result of an acute response to anaerobic exercise. So when we look at chronic adaptations at rest, anaerobic training leads to a decrease or no change in resting heart rate and blood pressure. So you can get a slight decrease in both of those measures as a result. And again, when you get that, that's a good thing, because that shows that your body's not having to work as hard at rest. Resistance training does alter cardiac dimensions. So there tends to be a lot of left ventricular wall thickness. So if you don't remember the anatomy of the heart and where the ventricle is, go back and kind of take a look at that. So you do get an increased thickness of that ventricular wall, which, changing sometimes the size of the heart. There's pathological changes, and then there's healthy changes. So as long as the ventricular wall thickness is increasing and there's no size change in the chamber, that's okay. And that's what you get with resistance training. So in other words, the thickness of the heart will increase, but the inside diameter doesn't change. There's pathological changes that could occur due to health conditions where the left ventricular wall thickness will increase, and then the inside chamber gets smaller. That's something you don't want to have happen. But as long as there's no change in the chamber size, which would be a result of resistance training, then there's no pathological or negative changes that are occurring. So when we look at chronic adaptations of the acute cardiovascular response, so in other words, what happens when you're, over time, again, when you do your training session in the immediate, how that response changes. So The chronic resistance training or long-term resistance training is going to reduce the cardiovascular response to an acute bout of resistance exercise of a given absolute intensity or workload. So in other words, if you keep that intensity or workload the same, your cardiovascular system is going to become more efficient. Basically what that means is it's not going to have as great of a response when you keep that all the same, because what's going to happen is the increases in heart rate and blood pressure aren't going to happen as much, because again, your body's becoming used to it. Your body's becoming used to that stress being applied over time. So each time you initiate that whatever resistance training you're doing to produce that response, it's eventually just going to become more efficient and not have as big of an increase. It's still going to go up. Your heart rate and blood pressure will still go up, obviously, but it's not going to go up as much because your body's become more efficient. When we look at ventilation, okay, so we look more at the respiratory response. So ventilation generally doesn't limit resistance exercise. So in other words, someone's respiratory system usually doesn't limit resistance exercise. So it's usually unaffected or could be moderately improved. So unlike aerobic exercise, which ventilation does become a little bit more of a factor, with anaerobic exercise, it's not quite as much. So you can get some moderate improvement through anaerobic training, but most of what's going to occur with that is where it becomes a limiting factor is more with aerobic exercise. So compatibility of aerobic and anaerobic modes of training. So, one of the things that we're going to have to look at, because obviously when we talk athletes, most athletes have to have a pretty well-rounded program. They have to combine both anaerobic and aerobic. Even when you look at athletes on complete ends of the spectrum, take a 100-meter sprinter and a marathon runner. The 100-meter sprinter still needs to do aerobic work. The marathon runner still needs to do anaerobic work. It's just the type that they pick and how they program it will be different, okay? So we have to look in compatibility. So combining resistance training and aerobic training may interfere with strength and power gains, particularly if aerobic endurance training is high in intensity, volume, and frequency. So again, this is why you don't see a marathon runner is never going to be a super strong person in the weight room, because of the reason that their aerobic endurance training is so high in volume and frequency that they're never going to have those strengths. However, they should still do strength training, and again, when programmed appropriately, they'll gain appropriate amounts of strength for their sport. So the key with this is, if you have a strength and power athlete, don't do too much aerobic endurance training. They still have to do aerobic training. They just have to make sure they recover from it and don't do too much. The flip side, there's no adverse effects of aerobic power as a result of heavy resistance training. So if you're doing heavy resistance training, it's not going to affect your aerobic power. And again, you can actually enhance endurance sports by doing resistance training exercise. So that's an important thing. Even if you're in what's classically an endurance-based sport, you should do some strength training. The strength training will still will still enhance your performance, and it's also going to help in injury prevention. So that's kind of an important note to make, when you're looking at kind of combining this, and when you get into, some programming concepts, you'll kind of see how to kind of review your volumes and things of that nature in order to get the effects that you want for the particular athletes. So what are the performance improvements from anaerobic exercise? So muscular strength. So heavy loads are the most effective for fiber recruitment. We kind of talked about the importance of heavy loads with the endocrine response and things of that nature. The effects of training are related to the type of exercise used, its intensity and volume. So again, making sure you're picking kind of those ideal parameters for the effects that you want is going to be very important. When we look at power, so again, muscular strength is just the ability to apply force. Power is the ability to both have force and velocity. So there's also a time component to power. So they don't mean the same thing, okay? It's important to note that power is quantified different from strength. One does affect the other, but they're not the same thing. So heavy resistance training with slow velocity primarily leads to improvements in maximal strength. So that would make sense. So while, you can get some power improvements from heavy resistance training with slow velocities, primarily the factor that's going to be improved is strength, just that pure ability to apply force. With power training is going to increase your force output at higher velocity. So when you're looking at improving rate of force development or how fast you apply force, now that kind of changes your parameter selection for your intensities and your sets and reps for when you're deciding to do this, okay? So it's important to kind of note that you kind of have that change, when you're looking, and again, there's a degree of muscular strength, a degree of muscular power that you kind of want to balance out when you're looking at your athletic population. It should also be noted that with strength, a lot of your adaptations occur of your muscle fibers going from type 2X to type 2A, which basically allows for greater fatigue resistance. So that's kind of another adaptation that you get when you're looking at changes that occur as a result of working on muscular strength. So again, continuing to kind of look at the concept of power. So again, power is the combination of both force and velocity. So peak power output is maximized during jump squat with loads corresponding to 30 to 60% of a 1 repetition max squat. So in other words, when working within that percentage range, that is going to enhance that rate of force development or power. For the upper body, peak power output can be maximized with ballistic bench press throw. So in other words, they're actually using an exercise where they don't just do a bench press, they kind of throw the barbell in the air, looking at 46 to 62% of the 1 rep max. Okay, so you can see here, we're not using per se super heavy loads in order to do this. It's really the combination of using the heavier loads and the submaximal loads and performing them fast that's really going to enhance overall power output. So you can't necessarily neglect the maximal strength work because, again, power still has the force component to it. But you can't just do all heavy stuff moving slow because then you never address velocity. So the combination of both of those will kind of enhance that overall athletic development. So other performance improvements, we look at local muscular endurance. We'll kind of talk about some of these different concepts. So cross-sectional data in anaerobic athletes has shown enhanced muscular endurance and subsequent muscular adaptations consistent with improved oxidative and buffering capacity. So in other words, they're able to kind of buffer, if you will, those metabolic, the kind of the results of the metabolic reactions that occur in the muscle that would cause fatigue. Skeletal muscle adaptations to anaerobic muscular endurance training also includes increased mitochondrial and capillary number, fiber transitions, buffering capacity, resistance to fatigue, and metabolic enzyme activity. So in other words, there's physiologic benefits to muscular endurance, most specific to the anaerobic adaptations, but you do get that. So there's increased anaerobic endurance as a result of doing certain types of anaerobic exercise. Body composition. So resistance training can increase fat-free mass and reduce body fat. So you get increases in lean tissue mass, you get increases in your metabolic rate, and energy expenditure during exercise are different outcomes of resistance training. So again, there could be positive changes to body mass and body composition. And then flexibility. So you can have, if you have someone with poor flexibility, a lot of times we get people with flexibility issues and we want them to just do static stretching and they can never understand why they're not getting more flexible. Part of the reason why they're tight or don't have as much flexibility is because of the fact they're not strong. So if you're not, you don't have enough strength in the tissues, the body's not going to be able to get into positions of high mobility. So if someone has really poor flexibility to start, the combination of resistance training and stretching will actually improve flexibility along with adding muscle mass, okay? So people always get worried about adding muscle mass and losing range of motion. I mean, for the most part, unless you're a high-level bodybuilder taking in a lot of calories and using anabolic drugs, you're not going to lose flexibility as a result of resistance training, okay? And a lot of times individuals will actually improve their flexibility as a result of resistance training. So again, looking at other improvements. Now, obviously, aerobic capacity, again, if we're doing anaerobic exercise or we're doing exercise where we can't use oxygen to supply the energy for the system, aerobic capacity, you're not going to see a lot of big changes. So in other words, heavy resistance training doesn't significantly affect aerobic capacity unless the individual is initially deconditioned. So in other words, in relatively untrained people who just do resistance training, they can actually improve their VO2 max or their ability to uptake and use oxygen as a result of resistance training. Now, if you do something like circuit training, where you're using high volume with short rest periods, kind of coupling exercises together, that can improve VO2 max, okay? Heavy resistance training by itself isn't going to affect that aerobic capacity as much, okay? Unless the person's deconditioned, or you're doing circuit training, which if you were doing circuit training with short rest periods, you're not really doing heavy resistance training exercise. Motor performance. So anaerobic training enhances motor performance. So we're looking at, different types of movements and things like that that would occur with sports can be enhanced. Again, as long as it's based on the specificity of the exercises or modalities performed. So in other words, if you're looking to improve running, okay, so one of the benefits with that is improved running economy or just being more efficient with your running. Well, if you want to become more efficient with your running, then your anaerobic training has to be done through running, okay? However, there is some carryover from some other exercises and things like that. They have shown that resistance training can improve running economy. It can improve your vertical jump. It can improve your sprint speed, tennis serve velocity, swinging and throwing and kicking performance. Again, much of that is going to be based upon your exercise selection. So being as specific as you can to whatever it is you're doing. Okay, so for instance, like a barbell back squat, getting stronger in that can possibly enhance your vertical jump. If you think about, again, the movement that occurs with a squat and with jumping, that can happen, okay? Obviously when you're looking at an upper body thing like throwing and things of that nature, you have to look at, obviously more of an upper body movement. But again, there is improvements in motor performance as we look at anaerobic exercise. Now we look at overtraining. So we kind of led into this earlier. Obviously, we have to, in order for changes to occur with the body, we have to provide a certain amount of load. However, there also has to be recovery with that as well, okay? So overtraining is defined as an excessive frequency, volume, or intensity of training that results in extreme fatigue, illness, or injury, okay? And again, it can happen due to obviously doing too much work, or it could happen as a result of insufficient rest, insufficient recovery, or insufficient nutrient intake, okay? And you can have both sympathetic overtraining and parasympathetic. So remember, your autonomic nervous system is two branches. It is the sympathetic nervous system and the parasympathetic. The sympathetic is what we call the fight or flight response, okay? So what takes place, when you're put under stress. The parasympathetic is what your body is at rest, or they also call that the rest and digest system, okay? So it's important to make sure that your body is able to recover. Now, the more common type of overtraining is the sympathetic type. That's usually what you would see with people. People who tend to be in your more endurance sports will sometimes suffer from the parasympathetic overtraining, and they both have different types of effects, okay? Now, there's also something called excessive training on a short-term basis, and that's what's called overreaching, okay? And there's basically two types of overreaching. There's functional overreaching, where you get recovery with days or weeks of rest, and then there's non-functional overreaching. So basically, your overreaching is something that you could sometimes do and plan within your training cycles, again, given the fact that you have appropriate recovery. However, when you get into overtraining, that's essentially when you get prolonged periods of, again, either excessive training or training without appropriate amounts of rest, okay? And overtraining can end up involving multiple systems of the body, and sometimes it can last pretty long. It could last beyond 6 months. So we got to make sure that you're, again, kind of getting your appropriate rest, and if you are going to do an excessive amount of training on a short-term basis and do the overreaching, that you're also programming that appropriately. So here's what we look at, and this table's in your book, so you could kind of, again, further look at it. But what this does is it kind of shows you when you're looking at different stages of overtraining. Okay, so in other words, you can look at acute fatigue, you can look at functional overreaching, non-functional overreaching, and overtraining syndrome. So these are things that kind of talk about, this table kind of nicely summarizes your kind of different effects that you would get as a result of each. So, you know, take a look at this. It kind of talks about what can basically happen as a result, and probably the most important thing to kind of differentiate between, because they're kind of similar and have similar effects, but you see it starts to get a little bit more when you look at the different things that occur with overtraining syndrome, it gets a little bit more extreme. But you know, once you get into that point of non-functional overreaching, that's when you're going to start to have changes that will eventually lead you to overtraining syndrome. Functional overreaching is something you can do and you can return to baseline as long as you then incorporate a period of prolonged rest. So kind of take a look at these changes that occur and be able to kind of pair them up with a different thing. I mean, obviously something like, you start with acute fatigue, that's basically what happens. So, you know, you have a hard workout training session, you're going to suffer from acute fatigue. You know, you look at performance, no effect or an increase in performance, you get altered neural function when you look anaerobically. That's just basically looking at it starting from the standpoint of just an acute fatigue perspective when you have one hard workout, as opposed to, you know, coupling hard workouts and then either getting the appropriate rest or not getting the appropriate rest. So we look at overtraining, we look at what are the markers of anaerobic overtraining. So the markers of anaerobic overtraining. So, you know, again, you're going to have things like, again, persistent fatigue, increased sense of effort, disturbed sleep, lack of attention, okay, are going to be all things that occur. Particular markers of anaerobic training, the psychological effects, you're going to get that decreased desire to train, decreased joy from training. There's going to be acute epinephrine and norepinephrine increases beyond resting levels. So remember what epinephrine and norepinephrine do. If you don't remember, go back to the chapter on the endocrine system. But that's going to be the start of your sympathetic overtraining syndrome. That will occur. So you'll get those acute effects that will basically put the person in a prolonged sympathetic state. And then you're going to get performance decreases. And many times the performance decreases are going to kind of show up later. So the problem with that is that it's going to be too late to be kind of a good predictor as far as how well they'll get better from the overtraining, because that's something that's going to come further down the road. So mistakes that can lead to anaerobic overtraining. So the chronic use of high intensity or high volume or some combination of the two. Okay. So that's going to be something that's commonly, and again, it's just going to be more or less lack of recovery in conjunction with that. So too rapid rate of progression. So again, you want to make sure that you're not utilizing too much volume, too much intensity, and progressing it too fast, with the individuals not being able to recover. The hormonal markers of anaerobic overtraining. So again, there's going to be an endocrine response to this. One thing you'll look at is a testosterone to cortisol ratio being thrown off. So there'll be an increase in cortisol because of the stress response. There'll be a blunted response of pituitary hormones. So a lot of the pituitary hormones will get will be kind of not functioning. They won't be released as much. Volume-related overtraining tends to cause increased cortisol, decreased luteinizing hormone, and also free testosterone. With intensity-related overtraining, there doesn't appear to be as big a change in the resting hormone. So volume tends to have a little bit more impact on what goes on with the resting hormones as opposed to intensity-related. Intensity-related overtraining, you still get a change in the hormone response, but there's more central nervous system effects that occur. Psychological factors related to overtraining, they'll have decreased vigor, decreased motivation, confusion, anxiety, impaired concentration. Those will all be things that psychologically that will come into play when you look at overtraining. So a lot of negative effects. So it's important to make sure that if someone starts to exhibit symptoms of this, that you kind of modify your training as quickly as you can to eliminate the possibility of this becoming an issue, because it could take a long time to recover from. And again, many times the psychological will be observed before the physical. So if you start to notice that, again, modify accordingly as we discussed. So DTraining, that's defined as a decrease in performance and loss of accumulated physiological adaptations as a result of stopping anaerobic training. So this is where you start to get loss of adaptations that occur as a result of discontinuing training. So if by chance you do have to lower what you're doing or decrease your volume, decrease your intensity for a short period of time, that's fine. But it's important to incorporate proper maintenance loads and not just stop doing training for a prolonged period of time. Now, they can also occur as a result that there's a substantial decrease in training frequency, volume, or intensity. So again, it doesn't necessarily mean that just because you only do it if you stop. So again, this is where it's going to be important. Again, it's always okay to back down a little bit, particularly when you're talking in-season training and things like that, but you have to make sure that you're doing enough to at least maintain. So it's important to note, so losses of adaptations can occur with strength within 4 weeks of discontinuing resistance training. Power actually occurs much faster, particularly sport-specific power. So that adaptation will happen much faster, and that's simply related to the neural mechanisms, okay? Oxidative fibers will also increase with detraining in strength athletes, which again, if you're a strength athlete, that's a negative thing. You don't want that to occur because that means your type 2 fibers are starting to atrophy. So fast twitch fibers are going to be most affected initially, which should make sense. They're the fibers primarily involved. The slow twitch will start to decrease in size and have their effects much later. Okay, so that happens with more long-term effects. So strength will actually last a little bit longer than power, but again, it's important to maintain this. Obviously, when you're looking at in-season training or getting closer to a competition, you do have to kind of lower your volumes and intensities to make sure that the individual doesn't detract from their performance, but you want to make sure that you limit how long you go with that. And some learning outcomes. So again, review the learning outcomes on your own. Make sure that you could kind of look at them and be able to make connections between the concepts we discussed.